I would start by, I guess, middle school to high school. I really liked the sciences. That's kind of where I started. My father was a physician, actually at St. Luke's. So I volunteered at St. Luke's transporting patients the summer between high school and college. Really enjoyed that, talking to the patients, learning their stories. And then throughout college, I took science classes, tried to keep my mind open to other things, but enjoyed medical research a lot, shadowed a decent bit, and thought medicine was a good thing to go into. As far as the specialty of radiology, kind of going off of that, I enjoy working with patients a lot. I also like the science and the problem solving behind medicine, and I think radiology is a lot of that. So that's kind of why I picked radiology.
Yeah, so I think for me, as we were talking about earlier, it's really just like about the people, about like the long-term relationships. I think something that I'm really looking forward to in the rest of my career is to have those like longitudinal relationships. I'm like really looking forward to, I'm going into radiation oncology, so I will be, meeting patients when they are getting a new diagnosis of cancer and being able to be there through their treatment, and then hopefully see them through the other side and kind of continue to see them through all of their follow-up visits. So for me, it's really about the relationships. It's really about getting to know my patients and being there for them for like years to come, and I'm just really looking forward to all that.
I would echo that as well. I think, in medicine you're so lucky because your job is you get to wake up every day and connect with someone. That's your job. And I think that depending on what the diagnosis is, there's not always a ton that we can always do, but we can always help and be a part of that person's life and try and connect with them. And I think that being your job description is a huge privilege.
Yeah, I think kind of piggybacking off of Max a little bit too, I have always been a big puzzle person and problem solver. So I think growing up I was the kid that was playing in my room building blocks and putting puzzles together and stuff like that. And so I think as I sort of developed interest in science and math, medicine was kind of a fun combination of also working with people and figuring out problems that are complex. And so I think specifically dermatology for me is a really fun mix of clinic, procedures. You get to see patients at every age for a long time, sometimes just a short time. And I think patients in dermatology are really motivated to get healthier skin, clearer skin, things like that. And so I think you develop a really strong relationship with them. And so I think that's something that I'm really excited for.
Like Max, I always was really interested in the sciences as well, and I thought about being a vet for a while before I realized that I'm allergic to almost all animals. But my mom was a nurse, and I just remember having family vacations and trips where she would just find random people that needed her, and she would immediately attend to them because she had the skills to do that. And that she was like superhero, like a superwoman to me, because I thought being able to have the skills and the knowledge and the desire to help everyone around us is something that is really magical, and it's hard to find. And she has always been a huge role model in my life, and I really wanted to follow in her footsteps. And I have always thought that we are so lucky in medicine to be in our patients' lives in what is sometimes the most vulnerable moment in their lives. And like as Jen said, it's a huge privilege, and being able to make their lives even a little bit better, I think, is so fulfilling. And medicine isn't always about saving lives, but I think a lot of it is just about improving one's life, and that can look very different depending on what specialty you're in. But in dermatology, I think a lot of it is improving the quality of one's life. And even if that's just with, coming up with a diagnosis or being one step closer to finding an answer, is really satisfying for the patient and also for us as well.
Yeah, what Jen said really resonates. What you said about, we're not necessarily fixing people all the time, right? I'm doing physical medicine and rehabilitation. I am not fixing a lot of my patients. They've had terrible spinal cord injuries or traumatic brain injuries and all this stuff. But I'm seeing how I can make some part of their life a little bit better every day, right? And that's what's so rewarding. That's what's so great. Being able to make that little difference. And those little differences will add up to a big difference in the end, right? That's the goal, is just how can I make them happier, healthier, doing what they love to do, spending time with the people that they love to spend time with, right? That's like the goal, and that's what brings us all joy. I think, oh God, it sounds terrible and cheesy, but my favorite thing about medicine is people, because I just love meeting, you know, my coworkers. I love meeting the patients. Everyone just has like such interesting stories, and I think medicine's a really great way to hear those stories and like really get to know people on a personal level. You know, you're engaged with them, you're taking care of them, and as much as you're taking care of them, they're taking care of you. They're giving you those stories and the smiles every day. And so, I don't know, that's my favorite thing about medicine. It's just all the people that you meet along the way.
Yes, I totally agree. I would also say the people is one of my favorite things about medicine, and one of the big reasons why I went into medicine in the first place. I feel like we're so lucky to take care of so many different types of people and so many different people from all over, especially at St. Luke's as well, and getting to hear their stories. And I always love asking my patients like what they do for work, or what they used to do for work, or what their hobbies are, because you never know what you're going to hear, and you hear some really interesting things. So I totally agree.
My favorite question is what their pet's name is. So every day I can ask, how is Chuck, or whatever their dog's name is.
I met a cat named Walter the other day.
Oh.
That's a good one.
I think just to add on to that, I think that as residents, we're in like such a special place, similar with being a medical student, where you just have like a little bit more time. And I just love that we, you know, don't carry that many patients, and we can go back in the afternoon, we can check on them. I feel like, especially in the hospital, patients, this is like a really like vulnerable time in their life, and we just have the opportunity, the privilege to be able to be there for them, and then be able to like impact, you know, maybe the rest of their life by like taking the extra time. And that's, I think, my favorite part of medicine.